should love your body no matter how you look. And there's nothing wrong with body positivity. Dove is the poster child of body positivity. As I said, there's nothing wrong with feeling good about yourself, but it turns out that the thinking behind not caring how big someone is or not telling them about the dangers of obesity, while well-intentioned, like many things, is causing a skyrocketing number of cancers in young adults. A new study out of the UK shows obesity is actually the leading cause to rising cancer. Cancer rates among 25 to 50-year-olds have surged, adding 35,000 cases a year. It's been a 24% increase of cases just since 2019. Perhaps, just maybe, bad habits during the pandemic, like unhealthy diets, lack of exercise, and I don't even know what this means, but it's on the list. Environmental risks could have added to this. With us now, Dr. Drew Pinsky, Chief Medical Board Member and popular television host. We'll get to environmental risks in a minute. It sounds something important or made up. I have no idea. But I would just add to that, how about the many years that we went on not telling people that, hey, when you're obese and overweight, that is a risk factor for cancer and for heart disease and for diabetes and a bunch of other bad stuff.
That's absolutely true. And what was happening was there was this huge pushback. The way you set this up was exactly correct. Of course you want people to feel good about themselves. You don't want them to feel ashamed about their body. It's the last thing we want. And people who were advocating for body positivity were also sort of looking at some of the data on vascular disease and heart disease and suggesting that maybe BMI was not a great way to assess somebody's risk for that, but there was never any doubt about cancer, colon, breast cancer, and that was completely obfuscated from the conversation because you weren't allowed to call it a medical issue. And unfortunately it is. The extraordinary phenomenon now is, now that we have a expensive medication to treat it, well, now it's a medical issue. Now you can take Mounjaro or Ozempic or these things. In the meantime, we have a food industry. I don't think people understand that the food industry is a business of addiction, not nutrition, but addiction. It's literally the tobacco companies that came over with the lobbyists, with the scientists, with the strategies that they use for tobacco and have developed the same strategy for foods, making them yummy and addictive and creating tremendous problems with our metabolic health.
Look, I think one of the reasons that it's so important to have you on is because you're willing to tell the truth. You're willing to take on the big industries and the big cabals, if you will, that cause America difficulty. But you mentioned colon cancer and you mentioned diabetes. These are two things that have an enormous effect and disproportionately affect poor Americans. Diabetes in particular, because of poor food choices and poor nutrition choices and availability. Not necessarily that's their own fault. South Park, of all people, made sort of the point you're making. Take a listen.
Okay, Cartman, if your doctor wants to put you on medication, your insurance will pay for it.
No, they said the insurance won't pay for it because, they're kind of new drugs, and so the only people that can get them are people who can pay $1,200 a month, and the rest of us get this.
What's this?
It's a prescription for Lizzo. Rich people get Ozempic, poor people get body positivity.
It's bad to laugh at, but when they nail it, they nail it. The irony, though, and I think we have to acknowledge this, right, is you got two healthy guys right now, who I don't want to speak for me, but for you, who's in shape and looks great and thin and everything else and do all right in their livelihoods and can really afford to care about their health in a way that so much of America cannot. And they were literally given this prescription to say, oh, don't worry about it, be happy being large.
I'm not sure that, unfortunately, the way the lobbyist works and the way the money flows is much more about us getting addictive to food. And I think as a result of that, the people responded with, we better do something. People are not feeling good about themselves. And fine. I don't think it was about being unable to access nutrition or unable to access, though your point is well taken. But the reality is that just a slight change in our diet, just an awareness, and I know change is hard. It is difficult for people, but moving more, eating less. I have patients that are afraid to be hungry. They fear it. It's like it's some sort of an hunger is a good thing a certain time during the day. It tells your body is alive and well and ready for some nutrition. It's not something to be feared. It's something to be expected as part of a healthy day. And the fact is, unfortunately, a lot of people are not aware. A simple awareness would help people make better choices in terms of eating more protein, watching out for the seed and the vegetable oils, not eating those yummy foods, not believing the food pyramid. 20% of our diet should not be carbohydrate. Again, that is all the money pouring into the lobbyists and the food organizations.
Right, 100%. I'm 100% with you. But yeah, one of the worst things ever created. But I want to get you to this because there's a bigger point here, right? You think about body positivity. Don't tell kids who are overweight that they're fat and they need to lose weight. Defund the police. It's okay to be fat. Drag queens reading stories to elementary school kids. Boys playing on girls' sports teams. These are all things that, in retrospect, common sense tells us are profoundly stupid and have really deleterious effects, as we are now finding out very quickly on this obesity issue. Yet they become orthodoxy, and if you question them, somehow you're racist, you're a bigot, you're a transphobe, you're a fatphobe.
Correct.
How does this happen?
Just think about how that even trickled into the COVID story. If you dared to question anything about COVID orthodoxy, you had to be crushed, you had to be marginalized. It's a very strange time that we're in, where the truth itself bears no issue. And in medicine, if you ignore the truth and you don't ascend to some truth and share it with your patients, particularly in the realm of informed consent, our part of our job is educating and informing our patients about the risk reward of every choice they make. If we are not doing that, we are not doing our job. But my gravest concern is this notion that the truth is just relative. No, particularly in science, particularly in biology, there are certain truths we can attempt to ascend to, and we should always strive to do so.
Thanks for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.